This High Court case was a very curious medical negligence case. Dr Kam was a neurosurgeon. He proposed some surgery on Mr Wallace's lower spine. The surgery involved two unavoidable risks. Inherent risks like this carry a duty for the medical practitioner to warn the patient, so the patient can decide whether to undergo the surgery. The first risk was a painful but temporary condition called neuropraxia, which would involve pain in his legs from being in the same position a long time during the operation. The second was catastrophic spinal damage and paralysis. Dr Kam did not warn Mr Wallace about either risk. After the operation, Mr Wallace did suffer from neuropraxia, and he sued on the basis that he wasn't warned of the risks. Here's where it gets tricky. He said that if he'd been warned about both risks, the neuropraxia and the catastrophic paralysis, he wouldn't have gone ahead with the operation. But he admitted it wouldn't have been the risk of neuropraxia that stopped him. It would have been the risk of major paralysis. If the only risk was the risk of neuropraxia, he would have gone ahead with the operation. Can you see the problem? Essentially, he's saying, I got neuropraxia, but if you'd warned me about an entirely different risk, then I wouldn't have gone ahead with the operation and I wouldn't have gotten neuropraxia. But at the same time, he's admitting that if there hadn't been a risk of major paralysis, he would have been happy enough to run the risk of neuropraxia. So should he be able to claim compensation for a risk that, on its own, he was willing to run? It's a curly one. The High Court decided that the risk of neuropraxia was completely separate to the risk of major paralysis. Because he was willing to run the risk of neuropraxia, the warning was irrelevant. If he had been warned about neuropraxia, he would have gone ahead with the operation anyway. The court said he is not to be compensated for the occurrence of physical injury, the risk of which he was prepared to accept. From this, we learn that each individual risk gives rise to a corresponding duty. A person suing in negligence must show a breach of duty relating to the risk which caused the harm they actually suffered. A failure in relation to other duties is irrelevant.